The negative effects of smoking. Background information. Everyone knows that smoking leads to cancer, but how exactly does it do that? It can shorten one's life by 10 years. 9 out of 10 that smoke start before the age of 18. Now, there are other ways to smoke other than cigarettes. There are e-cigarettes, hookah, you name it. Smoking cigarettes causes 87% of deaths of lung cancer, which is over half of its population. Quitting smoking can reduce the risk of a health-harming disease.
Smoking. According to the Mayo Clinic and the medical field, the belief that lung cancer caused by smoking begins from the damaging of the cells that line the inside of our lungs. Cigarettes and other tobacco products contain cancer-causing substances. When the human body inhales the tobacco smoke, changes almost start immediately on the lungs tissues. For short-term and beginning smokers, studies have shown that lungs are able to partially repair some of the damage, but for repeated offences, long-term smokers, the repeated damage over time causes the tissue cells to act abnormally, which eventually lead to cancer. There are two types of lung cancers. Lung cancers are known as bronchogenic carcinomas and are classified in two groups: small cell cancers and non-small cell lung cancers. Small cell cancers count for 10 to 15% of lung cancers. This is the most aggressive and rapidly growing form of lung cancer, and it is strongly related to smoking. Non-small cell lung cancers is the most common form of lung cancer, accounting for 85%. This causing effects to over 7,000 genes, which is 1/3 of our known human genes. These changes were linked to heart disease and cancers.
Smoking affects your heart. The chemicals in tobacco smoke harm your blood cells. They also can damage the function of your heart and the structure and function of your blood vessels. This damage increases your risk of atherosclerosis. Causes about 1 in every 5 deaths in the United States each year. It's the main preventable cause of death and illness in the United States. Here in the picture, you can see a healthy heart and a damaged heart. You can see a big difference. Smoking is a risk factor for many diseases, such like atherosclerosis is a disease in which a waxy substance called plaque builds up in the arteries over time. Plaque hardens and narrows your arteries. This limits the flow of oxygen and rich blood to your organs and the other parts of your body. Another disease is coronary heart disease. Occurs if plaque builds up in the coronary heart arteries. Over time, CHD can lead to the chest pain, heart attack, heart failure, arrhythmias, and even death. Smoking is a major risk factor for heart disease. When combined with other risk factors such as unhealthy blood cholesterol levels, high blood pressure, and overweight or obesity, smoking further raises the risk factor of heart disease. Smoking affects your blood vessels. The chemical in tobacco smoke harm your blood cells. They also can damage the function of your heart and the structure and function of your blood vessels. This damage increases your risk of atherosclerosis. It is a disease in which a waxy substance called plaque builds up in the arteries.
Smoking and emphysema. Emphysema occurs when cigarette smoke damages the walls between your air sacs over time. Tobacco smoke damages the air sacs in the lungs, and as emphysema progresses, breathing becomes a major effort and may require supplementary oxygen. Emphysema causes destruction of fragile walls and elastic fibers of the alveoli. Small airways collapse when you exhale, impairing airflow out of your lungs. Emphysema is also a common contributor of COPD. Smoking and COPD. COPD, chronic obstructive pulmonary disease. Smoking is the leading cause of COPD. Smoking is also a trigger for COPD flare-ups. It damages air sacs, airways, and the lining of the lung. Injured lungs have trouble moving air in and out, so it becomes difficult to breathe. 20 to 30% of chronic smokers will develop COPD. The lungs rely on the natural elasticity of the bronchial tubes and air sacs to force air out of your body. COPD causes them to lose elasticity and overexpand, which leaves some air in your lungs when you exhale. If smoking is extremely relevant in excessive consumption and COPD is developed, which can take several years, COPD can also cause many complications, including respiratory infections, heart disease, lung cancer, high blood pressure in the lung arteries, and depression. COPD is treatable. COPD is treatable with the proper management. Most people with COPD have to acquire good symptom control, and it can lead to a great quality of life.